Good morning, everyone. I am Linda Resnik, the Principal Investigator of CoStar, and on behalf of the CoStar Executive Committee, I welcome you to the first annual Summer Institute on Health Services Research. We're thrilled that you have made the trip to Boston for this event and are excited to have you with us for our inaugural event. Thank you for being here and for helping us to make this event a roaring success. Our in-person registration was full, and we are also pleased to have many more participants joining us by webcast. So welcome those who are joining by webcast. For those of you in the audience, this event is being recorded and webcast live. So CoStar launched just 14 months ago. We were funded by a 5-year grant from the Foundation for Physical Therapy, and we are a collaboration of 3 powerhouse institutions: Brown University, Boston University, and University of Pittsburgh. Our center was made possible by the very generous donations from many supporters, physical therapists, students, and of course the APTA. These donors, like you, recognize the importance of health services research and the urgent need to grow our capacity to address timely policy-relevant issues with research evidence. The physical therapy profession is at the forefront of disciplines recognizing the importance of health services research. We clearly understand the need for research that evaluates the value of physical therapy to ensure that physical therapy is properly represented within accountable care organizations, bundled payment initiatives, and pay-for-performance programs. We understand that comparative effectiveness research is needed to directly compare physical therapy and other interventions. We recognize that system-wide research is needed to evaluate and improve quality of care, as well as to best target resource allocation. While our field has long advocated for reliable, valid, and responsive outcome measures, we now understand that we must implement these standardized measures systematically and integrate this data into larger data systems in order to measure and improve the health of our patient populations. We have an emerging appreciation that physical therapy is provided within a wider healthcare team and not in a silo, that our patients may be treated by multiple providers and have comorbid health conditions. We are beginning to study the social and economic determinants of health of our patients and coming to an appreciation of population health management, the systems and policies that affect healthcare quality, access, and outcomes. And we now need a workforce of scientists and leaders with the skills and resources to conduct health services research. We're sincerely grateful to the Foundation for Physical Therapy and to the community of supporters who coalesced around this vision. I am honored and humbled to be spearheading this initiative. In our first year, CoStar made strides towards building health services research capacity and stimulating health services research. But we're just in the beginning. We have funded 4 pilot studies, hosted 2 visiting scientists and 1 faculty fellow, and we increased the visibility and enthusiasm for health services research. I look around this audience, and I'm truly in awe of the collective expertise and the potential that is gathered here. I'm excited to see both old friends and old colleagues and new colleagues, seasoned as well as new investigators, trainees, and other stakeholders. So I want us all to get a sense of who is here in the audience with us today. I know we have with us some academic deans. If you want to just raise your hand so we can see, we have some academic deans of programs. We have department chairs, faculty members, many faculty members, postdoctoral fellows, graduate students, and clinicians. Very good. Some of the members of our external advisory board are here, and I would like to recognize you if you would please stand, of the CoStar External Advisory Board. Thank you. And we also have scientists and research coordinators from a variety of settings, directors of home care and other services. And can you please raise your hands? Very good. And I especially want to acknowledge our distinguished guests from the Foundation for Physical Therapy. And I would like you also to please stand to be recognized. Barbara Malm, the Executive Director. Dario Dieguez, the Scientific Program Manager. And from the American Physical Therapy Association, please recognize Justin Moore, who's the Chief Executive Officer and member of our External Advisory Board. Robin Watson-Ellerby, Vice President of Research. And Karen Chesborough, Scientific Program Manager. And from the Patient-Centered Outcomes Research Institute, PCORI, please recognize David Hickam. He is also a member of our External Advisory Board. So thank you for being here. We have a great combination of people to move forward in this vision. And I want to extend my heartfelt congratulations to Pam Duncan on her thoughtful and inspirational keynote address last night. Dr. Duncan has been a career role model for me and for countless others, and she is recognized for her research and her research leadership that is truly transdisciplinary, impactful, and her remarks are always thought-provoking. Dr. Duncan is also a member of COSTAR's External Advisory Board and a staunch supporter of COSTAR, as you heard. And let's have a round of applause for our 22 poster presenters who presented last night. Thank you for sharing your work last night and helping to launch our event. I really think that was great to see your work and to have a chance to get to know many of you and view your posters. So we expect that the Summer Institute will be a rich learning environment to share scientific and practical knowledge, perspectives, and insights. And I'm certain that this institute will stimulate dialogue around issues facing the rehabilitation community. Help us identify important information gaps that we can address to inform policy, advance practice, and improve quality. These conversations will help sharpen our strategic thinking about how best to pursue and conduct the kind of research that we need. And today is a wonderful opportunity to share our common interests, strengthen existing ties, meet new people, and entertain new collaborations and COSTAR connections. Our speakers today are amongst the best in the country. We are fortunate to have assembled this amazing panel, and I know you are eager to hear from them. Today, we'll hear examples of collaborations between health systems and industries and health services researchers, and we'll learn how these types of collaborations are being used to study and improve care delivery. We'll also hear about pragmatic trials in a variety of settings, and we'll learn about studies that utilize large data sets. And finally, you will hear about the work of COSTAR's first 2 visiting scientists. But before we launch into our program, I want to recognize the work of several people without whom the Summer Institute would not be possible. Mary Slavin and her team from BU. Mary, are you here in the room? Please give a round of applause to Mary. Mary is a member of our executive committee of COSTAR and the co-director of the Evaluation and Dissemination Core. And I have to say that this conference was so well organized, and that Mary and her team have organized and handled all the logistics so deftly and thought of so many details, and we feel very taken care of. So this room is beautiful, and it's an ideal space for the meeting. And thanks also to the BU media team for their work on the webcasting, when we appreciate all your assistance. I want to also thank the event sponsors who helped to defray the cost of the reception last night. We had sponsorship from the College of Health and Rehabilitation Sciences at Sargent College, from the Boston University Health and Disability Research Institute, and from CRE Care. And of course, thanks to the Foundation for Physical Therapy for supporting the Summer Institute and COSTAR. So a round of applause for the sponsors, please.